This morning, what you should know about the coronavirus pandemic. How long will it last? What you could do to protect yourself. We'll hear from two medical experts and a psychotherapist on how to calm your anxieties. Plus, the devastating economic impact. How safe is your 401k and other investments? We'll be joined by a leading economist.
Now from 42nd and 2nd, this is New York's very own Pix 11 News Closeup with Marvin Scott.
Good morning. The coronavirus has changed the way we live the past few weeks. It's created uncertainty and fear. This morning, we'll hear from two medical specialists about what you should know about a disease that the World Health Organization has now declared a pandemic. The coronavirus now has spread across more than 100 countries, and as of this taping on Friday, more than 127,000 people worldwide have been infected, more than 68,000 have recovered, and just over 4,700 people have died. And it is feared the number of cases will rise significantly before the disease is finally contained. The pandemic has infected our economy as well. The stock market has taken its sharpest declines in years. Businesses are closed. People are staying home. With major events being canceled, including the unprecedented suspension of all Broadway shows until April 12th, Live Nation tours being postponed, and sporting events, including the MLB, the NHL, NBA, and more suspending play. Governor Cuomo has declared an emergency in New York, and he has placed a ban on gatherings of more than 500 people. To learn more about the virus, I'm pleased to be joined this morning by Dr. Anthony Santella, a professor of public health studies at Hofstra University and a health service researcher who specializes in infectious disease prevention and control. And Dr. Dina Ajamulam, known to her patients as Dr. Dina, is a doctor of internal medicine and endocrinology and director of the weight loss program at Mount Sinai. Thanks so much for coming in. There's so much anxiety, so much misinformation and concern. What is it that our viewers, what is it that they should know that's most important about this virus?
I think the most important thing that people need to remember is that they need to be protecting themselves and their families from this virus. So making sure that they're washing hands routinely when they don't have access to soap and water, making sure they're using some hand sanitizer, doing this social distancing that our public health officials have been speaking about is very important, and really paying attention to those high-risk individuals out there, those who are elderly, who have some underlying comorbidities, and may have traveled to affected areas. I think what's important is to just remember that we're all in this together. There is a light at the end of the tunnel. Everyone is very fearful and scared of what tomorrow holds, but we know from a lot of data coming out of China that soon in the future there will potentially be an end to all this chaos and anxiety.
Let's get into more on that in a moment.
Yeah, I think in addition to what Dr. Dina mentioned, we have to be conscientious of not just those in our household, friends, and family, but those in our community. You might think this is just not a big deal, right? We experience cold and flu, but think about those that you have interactions with, like your grandparent, like the person who you may work with who may have an underlying illness. This is more than just about the individual, it's about the community.
Now, while the public health officials say we should expect more cases, they say that the risk really is very low. Is that true?
So from what we know, the risk is low, but as more and more cases are coming about, as we do more and more testing in the community, that risk is going from low to more of a moderate risk as more and more people are being exposed. So what I've been telling a lot of my patients is to really understand what their risk is. Are they in that low risk? Are they in the high risk? And what they can be potentially doing to maintain their safety. So for a lot of my high risk individuals, as I'm an endocrinologist, I take care of a lot of patients with diabetes, we discuss how they're high risk and how they can sort of limit their exposure, like traveling, for example. So as long as you understand where you are in that spectrum, you're able to isolate yourself.
And now that we see testing capacity increasing, thankfully, we're going to see more cases. That's inevitable, right? More people are going to get tested and hopefully receive the care and treatment that they need to recover. We know that 80% of cases will have mild infection and recover easily. But we've heard this concept of community spread happening right now. That means individuals are being exposed and potentially infected by people that they're not sure how it's happened, right? I traveled on the train this morning. I came to the studio. If I, in 5 or 6 or 10 days, start getting symptoms, I can't pinpoint that to a particular individual or situation. And so we just have to be very conscientious about our movements, our actions, and with the community that we live, work, and play in.
Is it true that you don't have to have the symptoms to be able to transmit? You can transmit the coronavirus without even having symptoms of it if you've been exposed yourself. Is that correct?
So the truth is that there is a potential pre-infective phase where you are asymptomatic, but most people stay in that early phase for a short period of time. There's a thought that maybe people are asymptomatic and still shedding the virus, but from data that we have from China, that's actually pretty rare. That's less than 1% of the cases. So most people who do have the virus will mount some sort of infectious symptoms.
Now, the Centers for Disease Control said of those infected that the cases here, mostly in the United States, would be mild cases. Do you concur with that?
I mean, this is a rapidly evolving situation. So what the CDC said 2 weeks ago, 1 week ago, and yesterday may change by the time this show even airs. And so we do know, based on what's happened in other countries, that about 80% of individuals infected will have mild disease, about 15% moderate, and only about 5% will need critical care interventions. And so yes, the majority of people will recover nicely, move on with their life, and in about 2 weeks' time, will be quote unquote back to normal. But unfortunately, like with most viruses and most infections, particularly pandemics, some people are going to be hospitalized and some people are going to die from this.
Now, let's talk about those who are most vulnerable. You talk those who have weakened immune systems. You're talking about the elderly. You're talking about people with diabetes. Who else?
That's right. So we're talking about people who have weakened immune systems that can also be attributed to medication. So patients who may be on cancer treatments, which are suppressing their immune system, people that are taking other medications for inflammatory conditions that might be suppressing their immune system. So you should definitely speak to your doctor to discuss this in terms of what your risk truly is and how you should be protecting yourself.
Let me mention something about just the health systems and providers. Everyone has a little bit of anxiety right now. And so what we don't want people to do is be running to urgent care or their primary care doctor or the emergency room because they have cold-like symptoms. We want it. We've seen these images of flattening the curve. If everyone starts rushing to the emergency room, our health systems and hospitals are not equipped, and you can speak to this as well, to handle that. And so we need people to call their provider, describe their symptoms, describe who they've been in contact with, where they've been traveling recently, and then the provider will use his or her best clinical judgment to decide, okay, you know what, you just need to stay home for a few days, or we're going to check on you tomorrow or the day after, not rushing and taking spots of hospital beds that really are needed for people who need them.
So actually, this is really, the symptoms are really like a very common cold. You're sneezing, you're coughing, you're feeling achy. But one of the markers would be a high temperature, isn't it?
That's right. So in the common cold, people don't typically have fevers. And so one of the common symptoms that we expect of corona is to have a fever. Other things might be shortness of breath, and shortness of breath that's worsening over time is really a red flag to see your provider right away. Just to touch on one of the points that you made, a lot of patients have been asking me, why can't I get tested so easily for this virus? And why can't I come to your clinic and do it easily? And the reason why is because for those who are actually testing for this virus, they need to be prepared. They need to have all of the protective health equipment available, goggles, 95 masks, gowns.
Okay, so basically, as I understand it, if you have a cold, you're feeling achy, but you don't have any fever, just stay home, take it easy, a couple of aspirin or whatever.
Yeah, the most important.
Right, don't panic.
That's right.
Okay, we'll take a break.
Sure.
When we come back, we'll be joined by a psychotherapist to talk about stress, how that's impacting everyone during this pandemic. We'll be right back.
You're watching New York's very own Pix 11 News Closeup with Marvin Scott.
Media coverage of the coronavirus has created a public awareness, but also it has created anxieties and fears. There are many myths about this disease. Stacey Ann Gooden takes a look at what's true and what isn't.
What's fact and what's fiction? COVID-19 can live up to 3 days on a surface. Fiction. The reality is it's unclear how long the virus can survive once it settles. That's why disinfecting surfaces and frequent hand washing are essential. Coronavirus is more fatal than the flu. That's a fact. The World Health Organization says 3.4% COVID-19 cases have been fatal, whereas the influenza mortality rate is less than 1%. The Associated Press reports well over 80,000 confirmed cases in China, which makes us susceptible when buying goods from there. Fiction. If an infected person sneezes on an item, the virus won't survive a trip to the U.S. The virus only affects the elderly. Fiction. Even though seniors are more at risk, people of all ages can contract the virus. As temperatures get warmer, COVID-19 is less of a threat. That is a fact.
Scientists have studied these patterns that viruses, like the coronavirus, tend to have a lower risk of spread during the warmer months.
The coronavirus causes stress. That is also a fact.
Stress indeed. Joining us now to talk about that is psychotherapist Robbie Ludwig, along with doctors Dina and Anthony Santella. The doctors have talked about immune deficiencies as a contributing factor.
Right.
But stress, too, is also very relevant.
Yeah, and so what I'm recommending to a lot of my patients and people that I talk to on the air is self-care is so important. You want to eat right, sleep right, make sure that you feel socially connected, take care of yourself, because we're in this paradox, right? You want to take care of yourself, so you build up your emotional immune system and your physical immune system. And we know certain things that we can do and take control over that can keep us safer rather than not.
So you deal with patients, and what do you tell them about the anxieties of this whole thing?
That's right. So we've been spending a lot of time talking to patients about mental health well-being as well as physical well-being. So mental health well-being, we focus on stress reduction tactics, whether or not that's exercise, deep breathing, meditation. And often we also speak about diet as well. So there's many different supplements and nutrients that you can take in that are loaded in vitamin C as well as zinc. Things like selenium is very important that comes from mushrooms. Actually, recently there's been a product called AHCC coming out of Japan, which has been really important for helping with T-cell immunity support.
I think what makes this difficult is we're asking people to take action in times of uncertainty. This situation, as we all know, is rapidly emerging and evolving. And so, do I really want to do all that when what they said last week doesn't apply this week, where tomorrow they may tell me something different? I'm just going to keep doing what I'm doing. And that makes it tricky.
I think it's important too to stay positive, because we have the benefit of learning from other countries. We see what China is doing that works. We see what doesn't work so well. We have a way to identify the illness. And also, we know that it's not fatal in all cases. I think people hear coronavirus and with their anxiety think, oh, that equals death. Sometimes yes, but there will be a lot of cases that people will have mild symptoms and will survive. So I think it's important to underscore the realities, because panic leads people to behave in ways that are not in their best interest.
Is part of it being oversaturated with information?
Such a great point. Great point. Yes,
That
oversaturated.
we read too much?
And rumors, and rumors that are everywhere. We were talking in the makeup room how Facebook, all of a sudden, everybody's an expert, whether they're, a hairdresser or a publicist. They're giving medical information.
There's just so much information, on the internet out there that are at our fingertips. And it's really important to talk to your healthcare professional or follow really important sources of information. The CDC, the WHO, information coming from Dr.
That's
Anthony
a good
Fauci.
idea. Go to the CDC
Absolutely.
website.
All you have to do is go coronavirus.gov, and it'll take you directly to the CDC website. That's where we should be getting our information. We should be following the science, not social media.
That's absolutely
true. And social media is designed to make us feel like everything's an emergency. So you want to go to the right sources, and also give yourself a limit. You don't need to study this 24/7. You could look at it once a day for 30 minutes. Give yourself a time limit.
How do you explain this to young children?
Well, I think children respond to their parents' anxiety. So if you can present something in a very matter-of-fact way, allow them to ask you questions, and remind them that really kids with this particular virus are not so much in danger. So I think that's tremendously comforting.
Yeah, absolutely. And also within, schools, they're doing a lot of information about hand washing. Teaching children the importance of hand washing is
What's
very
that website
important.
again?
Coronavirus.gov. And it'll take you
Coronavirus.
directly to the CDC website. Let me just
Okay.
add that
You get the facts right there.
Yes.
age-appropriate, medically accurate information, you could be talking to a 5-year-old or a 95-year-old.
In the limited time we have, let me ask you this. Have we seen bottom yet? Is this going to see its course, run its
You
course,
mean
and how long?
peak? We haven't
So
seen
I
peak.
think that we're on the way of seeing more cases as the disease starts to spread. As we start doing more testing, we're going to have a more adequate number of people who actually are testing positive. But as I said before, there is a light at the end of the tunnel. I do believe that.
How long?
I think the length is unclear. We know that we're getting a lot of information out of Wuhan now, businesses reopening, people going back to their daily life very slowly. But of course, we have to be cautious, and every country is different. So we're
We're
trying
going to have to
do
be
the best we
prepared to
can.
be inconvenienced probably for March and April. And that's just the reality of it. The things like you mentioned earlier, Broadway closing down, schools moving to online, these are things that will get past.
Will the warmer temperatures have any impact?
So the thought is that most cold and viral seasons do better during the warmer the warmer temperatures, because we tend to be outside. We tend to be not isolated in a home where it's very easy to spread disease.
And
that
also
way.
stay socially connected. It's very important that we feel supported during this time.
Okay, Robbie Ludwig, Dr. Dina Adremulam, and Dr. Anthony Santella, thank you so much. Very, very important information
Yeah.
that we related here. And everyone take care of yourself and wash your hands.
Thank you
Okay,
so much.
we'll take a break. We come back. We'll talk about the impact on our economy of this coronavirus. Stay with us.
You're watching New York's very own Pix 11 News Closeup with Marvin Scott.
The coronavirus and the measures being taken to combat it have had a devastating impact on our economy. Stocks on Wall Street, they've plummeted, with the Dow Jones Industrials on Thursday taking their biggest one-day loss in 33 years. Events are being canceled, cruise ships are not sailing, businesses are closing. So how much worse could it get? Here to answer that question for us is Robert Brusca. He's the chief economist for Fact and Opinion Economics. Good to have you with us.
Good to be with you.
Have we hit the bottom yet?
Oh, I wouldn't want to be the one to forecast that. I think we're probably pretty close to it. This is a substantial correction. I think that there are now remedial steps being taken, so there's a much better chance that we're going to find a trading range down in this area. But so far, policies are still being put in place. Although I would caution people about thinking that there is a policy to stop this. The economy is weak. We're probably going to have a recession this year, and there's probably nothing you can do to stop it. And that's because the steps that you take to slow the expansion of the virus are going to slow the economy. And so you can't put your foot on the brake and then say, well, because my foot's on the brake, I need to put it on the accelerator. It doesn't work that way. The economy has to slow down. We'll probably have a recession. And this is to keep the interpersonal contacts from spreading the virus too much and too fast. But the key is, during that period of time, to have support mechanisms for people so that after we get through this period where the economy contracts and where the virus doesn't get out of control, that we can come back and we can grow. And so that's what we're looking for our policymakers to do, not to stop the recession, but to support the economy during its period of need.
And what is the impact for the average viewer to understand? What is the impact of the recession?
Well, if you have this kind of recession, and if they do things to pay people's medical bills who don't have medical care, and encourage people who are at the low end of the pay scale to go to the hospital and not to stay on their job and spread the disease, and give them wage support when they have to leave work, then basically we can keep this to a very, very manageable proportion. And when the virus has played out, we'll be able to go back basically to where we were. The stock market can go back to where it was, and we can continue to grow. But we can also follow this up.
Now, the Dow has lost 20% over its high, the high in February,
Yes.
signaling the end of an 11-year bull market. We're now in a bear market. What do you tell people about their 401ks?
I tell them this: don't look at them. There isn't anything you can. I mean, if you wanted to do something, this is probably not the place to do it. Right, with the market some 20 to 25% off its highs, you're very much in correction territory. You know, you've lost most of the value. If you didn't sell already, you're much better off probably sitting here with what you have and playing it out. People are going to have different schemes. So you can buy this or you can sell that. But the things that are going to go down real hard have already gone down real hard. And the other plays that you have are going to be niche plays. So I don't know that you can greatly affect your portfolio by doing that. You should think in terms of getting stocks that are going to perform well over the long run. And you can get some value. So if you have money out of the market, that's what you should think about. You should think about the long run.
Don't go in for bargains right now when there are these record lows?
Well, yeah. I mean, if you have money to put to work and you feel comfortable with it, yes. But, there still may be some more downside, right? We had a much bigger downside in the financial crisis. The stocks fell some 40% at that time. So I would not say there's no downside here, but I would say the downside seems limited. The upside seems much more promising. Look, there are a lot of economists calling for the Fed to do 75 basis point rate cuts who have the economy growing at 2.5% and 3% at the end of the year. I don't understand these calls. I don't think the Federal Reserve should be cutting rates here. I don't think that's going to help. I think the economy is going to do what it's going to do because of the things that are being taken to address the virus. And you can't cut rates by 75 basis points and think that that's going to inoculate people in any way and send them back to work. That's not how it works.
So you see it getting worse before it's going to get better?
The economic numbers are definitely going to get worse. We actually haven't seen bad economic numbers. The economic numbers have held up, through February, partly because of the survey dates for some of these economic reports. But we did see a number from China for February that was just terrible. One of their PMI numbers, it just fell very, very sharply. And we could see the bottom fall out of a lot of economic statistics for the U.S. and Europe come March.
Well, it hasn't hit the labor market yet because the latest figures show that the unemployment rate has dropped.
Right.
In February.
Right.
So that hasn't been touched yet. So gaze into your crystal ball for a moment. I mean, we're looking, me and all of our viewers out there, how long, they always say what goes down comes back up. My broker tells me that all the time. How long of a period should we expect?
Well, you had the health experts out here, and those were the people that you should have asked, because this is a question about the virus, not about the economy. Mm-hmm. What happened now is the virus now becomes a variable that you put into your statistical model to predict how the economy is going to do. And so you ask a healthcare professional how that's going to perform, not an economist. I don't know, but people are talking about certainly a couple of quarters, and if we manage it badly, it could be longer.
Let's talk about New York, the impact of New York. In my period in New York, I never remember Broadway closing for a solid month. We're having canceling events, major sporting activities. What's going to be the impact here in New York City?
Oh, it's going to be huge. The impact on jobs from tourism, a lot of jobs are created by tourism. But you got to understand, there's a lot of contact, right? Broadway brings a lot of people together. There's a lot of contact. This is a petri dish to spread the coronavirus. And so is the everyday commute in and out of New York. And so you have to do this to keep this thing from spreading in New York. Otherwise, we would have this thing running rampant everywhere.
Yeah, Broadway alone, if I read the figure correct, is $10 billion a year business and plus the tourism. Let's talk about the president's plan for his stimulus package. He says he will have a dramatic stimulus package, which will involve extending our tax deadline in April without any interest, and also sick paid leave. What do you make of that? Is that going to help?
Well, he's talked about getting rid of the payroll tax, and that's good for people who are working. If you're not working, or if you get laid off, then that doesn't help you very much. So that's one problem. Another issue is what you do to encourage people to go get health care if they don't have any. So you need to make testing free, and you also need to have some support for people who wind up having to miss work, who have low-income jobs or they're not paid for missing work. So you need to have some leave policy. And I know the Democrats are trying to put some of this into their proposal. So we're going to have a proposal from the Democrats in Congress that's going to have to go through the congressional progression, and the president's going to have to approve it. And so these two sides have to decide to do things that maybe they're opposed to in a long-run sense, but they need to do something that will help to cement public health during this period when there's so much risk.
So bottom line, be patient, don't panic, hang on to your 401k, hang on to your stocks. It will come back in time.
I think that's the bottom line, yes.
Robert Brusca, always a pleasure to have you on the program. Thank you for joining us. And that'll do it for our program for this week. If you have any comments or wish to see this broadcast again, log on to our website at pix11.com/newscloseup. Up next, Greta Van Susteren and Full Court Press. I'm Marvin Scott. Thanks so much for joining us. Enjoy the rest of your Sunday, everyone, and stay healthy.